Bismillahirrahmanirrahim. Viewers, let's talk about the disorders of parathyroid glands. So today my lecture is in physiology. Okay. First of all, we will define the parathyroid gland. Parathyroid gland, as we know that there are different type of glands which are present in the human body, and these glands are responsible for some particular type of secretions which are called hormones. Now there are some glands which are endocrine glands, while some glands they are exocrines. So endocrine glands are those glands which are ductlets. There is no duct system. So whenever there is no duct system, it means they can pour their secretion directly into the blood. So when there is duct system, when there are true drugs, when there are true uh, ducts system, so it means that these hormones or these secretion can take place through these special ducts. So parathyroid gland consists of four small glands which are paired and located behind the thyroid gland and the neck. The parathyroid glands produce and release hormone that is called parathyroid hormone or PTH or parathormones, which is involved in regulating the metabolism of calcium and phosphorus. So it also plays an important role in tooth and bone mineralizations. So you can see here parathyroid gland, which is just located below the thyroid gland. You can see here this one is epiglottis and then pharynx. This is thyroid gland. So below it you can see this is parathyroid gland. Here is trachea and here is thyroid cartilage and blood vessels. Now come toward the basic physiology of thyroid gland. As we know that different type of hormones which are secreted by the different glands. So one of the major gland that is parathyroid gland, and parathyroid gland is the major function of parathyroid gland is to maintain the body calcium as well as the phosphate level within a very low range so that the nervous and muscular system can function properly by parathyroid hormones. Now let's see here. Whenever there is low blood calcium level, so in that condition there is increase the parathyroid hormone release. So when the parathyroid hormone release become enhanced, so ultimately there increase the blood calcium level. As a result of the bone breakdowns occurs and it release the calcium. While on another side, when there is increased the parathyroid hormone secretion, so as a result of the intestine absorb more calciums and the kidney hold more calcium and increase the vitamin D production. So as a result of increase the blood calcium level. So as we have already discussed that they are majorly they are responsible to control the calcium metabolism as well as the phosphate. Now there are some disorders which are related with the parathyroid hormone secretions. Let's suppose in case of diabetes, you will have to keep a proper limit in your body. So it's the same case with balanced diet. So you will have to maintain the concentration of all these electrolytes, all these constituents which are present in your blood. So it should be at the normal level. In case of, let's suppose, our body need glucose in certain quantity. So in case of, let's suppose, if the concentration of the glucose in the blood become overactive, or increase the concentration of glucose in the blood, so ultimately there may be a chances of diabetes mellitus. While in case of hyposecretion or decrease the production of glucose in the blood, so ultimately there will be a chances of hypoglycemia. So both the condition, they are not the normal condition. So you will have to maintain the proper balanced diet. You will have to maintain the concentration of all these things in your body. So the disorder of the disorders which are related with the parathyroid hormone. In case of overproduction of thyroid hormones, which is secreted by the parathyroid glands, hyperparathyroidism will be occur, while in case of hyposecretion or decrease the production of parathyroid glands, so hypoparathyroidism will be occur. So you can see here on my screen that in case of hyperparathyroidism, which is a metabolic disorder with excessive secretion of parathyroid hormone like PTH extensively above the normal level, that is 12 to 70 picogram per ml. While in case of hypoparathyroid hormone, so you can see HPT, it can be characterized into the primary, secondary, and tertiary forms. Now, how we can differentiate between the primary, secondary, and tertiary forms whenever in case of hyperparathyroidisms? Hyperparathyroidism is a disorder characterized by the excessive amount of parathyroid hormone secretion by parathyroid gland. Depending on the cause of the parathyroid's hormone productions or hyperparathyroidism, so it can be characterized into the primary, secondary, and tertiary forms. Now, the different signs and symptoms or clinical features which are reported in case of hyperparathyroidism. The symptoms may be so mild and non-specific that they do not seem at all related to the parathyroid functions, or they may be severe. So the range of signs and symptoms include fragile bone, that is the fractures, for example, in case of osteoporosis. So there may be chances of kidney stones, renal stones formations, excessive urinations, abdominal pain, and tiring easily or weakness, depression or forgetfulness. These are the uh, mild signs and symptoms which are reported by the different literature. So bone and joint pain, these are also the common signs, symptoms, frequent complaints of illness with no apparent cause, nausea, vomiting, and loss of appetite may be occur. And hyperparathyroidisms, it may be primary, it may be secondary and tertiary, so it can be divided into three categories. And primary hyperparathyroidisms, you can see it is further divided into three. So in primary one is parathyroid hyperplasia, while the second one is parathyroid adenoma, and the third one is parathyroid carcinoma. While in case of secondary and tertiary, that is the secondary one is parathyroid hyperplasia, and the tertiary one is autonomous nodules on the top of hyperplasia. Now come toward the primary hyperparathyroidism. So what is happening here? So the primary hyperparathyroidism is defined by increased the parathyroid hormone production related to an parathyroid adenoma. In the most common cases, 85% of the cases which are reported, which is followed by the parathyroid hyperplasia and parathyroid carcinoma, which is 1%. Biological examination often reveals the hypercalcemia and low or the normal serum potassium level or phosphate levels. So kidney stones, which are reported here, and hyperparathyroidism, jaw tumor syndromes detected by aggressive generalized osteoporosis, and as well as there are many cases which are reported. And primary hyperparathyroidism, about 50% of the patient have no symptoms, and the problem is picked up as in incidental findings, or you can say that is accidental findings via rise calcium characteristic, X-ray appearances, or subperiosteal resorptions of the phalanges of the index and the middle fingers. So you can see these different type of pictures, which is called subperiosteal resorption of the phalanges of the index and the middle finger. So this one is the middle finger. You can see the different type of abnormalities. While in case of secondary hyperparathyroidism, when the parathyroid glands are stimulated to produce increase the amount of hormone to correct abnormally low serum calcium level in different physiological or pathological conditions like renal failure, intestinal malabsorption syndrome, decrease of vitamin D production, thus resulting in parathyroid hyperplasia. This is the secondary form of hyperparathyroidism. So in this case, whenever the parathyroid glands they can be activated or stimulated, as a result of there is increase the quantity or the amount of hormones. So it must be corrected abnormally. So it should be corrected abnormally whenever there is low serum calcium level and different physiological or pathological condition, like in case of renal failures, in case of intestinal malabsorptions, syndromes, and whenever there is decreased the production of vitamin D. So as a result of parathyroid hyperplasia can be occur. And tertiary hypoparathyroidism, this is another conditions. So in this case, when the long-standing stationary, or you can say secondary hyperplasia become autonomous in spite of correction of the underlying stimulants in case of renal transplant. Okay, let's see here the radiographic findings. Hyperparathyroidism is the most common cause of generalized radification of the jaws. The radiograph is typically described a loss of medullary trabecular patterns, jaw pairs, finally radio fake described as clear ground glass appearance. Okay, so this is you can see here in the picture. This case shows a decrease the bone trabeculations. The bone trabeculations are giving it the ground glass or granular appearance. Now, how it can be diagnosed? So, diagnosis, serum parathyroid hormone, the normal range 15 to 65 picometer per ml in calcium. Its normal range is 9 to 11 milligram per deciliters. The gold standard of diagnosis is the parathyroid immunoassay. Once an elevated parathyroid hormone has been confirmed, the goal of diagnosis is to determine whether the HPT, hyperthyroidism, and primary or secondary is in origin by obtaining the serum calcium level. Very high serum calcium level due to indicate the primary hyperparathyroidism, whereas lower normal calcium level may indicate the secondary hyperparathyroidism. Tertiary hyperparathyroidism is a high uh, PTH and high serum calcium, so it is differentiated from the primary hyperparathyroidism by history of the chronic kidney failures and secondary HPT. So I means whenever there is any kind of disease, so there may be chances of other complications which become the cause of such kinds of disease. So you will have to adopt some precautionary measurements in order to minimize these complications. Alkaline phosphatase, this is another diagnostic test which is performed for the to find out the exact cause or the clinical etiology. So that is the alkaline phosphatase. Its normal range is 500 to 750 IU per liter. The alkaline phosphatase level are usually elevated in HPT high in case of hyperparathyroidism. So in primary hyperthyroidism's levels may remain within the normal range. However, this is inappropriately normal given the increased level of the plasma calcium. So all these diagnostic tests they are important to find out your goal. Uh, and oral manifestations in case of dental abnormalities, like in case of obliteration of the pulp chamber by the pulp stone or alteration in the dental eruptions, loosening and drifting of tooth, uh, malocclusions, and spacing of teeth, partial loss of lamina dura, and periodontal ligaments widenings, and teeth become sensitive to uh, percussions, mastications, and floating teeth, as well as sometimes brown tumors, generalized bone reduplication of jaw, soft tissue calcification, hypercalcemia may result, and cellulithiasis, and mandibular tori, and complaints of jawbone pain. Dental management of the patient with hyperparathyroidism. Clinical management of this patient doesn't require any special consideration. We should know that there is a high risk of bone fracture, so we must take precautions in surgical treatment. Jaw enlargement is treated by recontouring of the maxilla and mandible. The three-dimensional reconstruction of the computed tomography scan was helpful in evaluating the facial abnormalities and treatment plannings. So this is actually the protocols, the dental protocol or dental management of the patient with hyperparathyroidism. For example, let's suppose if a patient who have hyperparathyroidism, so in that case, how we can manage the patient. So if he has hyperthyroidism, so in that case, the dental management of the patient, these are the clinical management which is required for the patients. So there are multiple conditions which is associated with the patient. So we should know there is a high risk of bone fracture, especially at the facial regions. So you will have to take much care about the patient because in that cases there may be a chances of fracture, bone fracture, and many other complications. Uh, a thoroughly clinical and radiographic examination is essential before providing endodontic treatment. The sequence of diagnostic procedure must begin with a well-organized review of the medical history, and there are a number of systemic diseases that can cause bone lesion throughout the body. In some instances, These lesions appear in the periapicals region of the teeth and can lead to a misdiagnosis of the lesion of endodontic origins. Finding of the periapials radiolucency on a radiograph shouldn't automatically lead to access opening and root canal therapy by the dentist. So, inshallah, in my next lecture, we will talk about the hypoparathyroidism in detail, that about the basic physiology of hypoparathyroidism and its etiology, causes, its diagnosis, its oral and dental manifestation of hypoparathyroidism, and its oral manifestations, patient with parathyroid gland disorder, and its dental management, and as well as the special reference. All these data have been taken from the different literature. So once again, so I'm very thankful to all my well wishers, all my students and viewers for watching this lecture. Um, Wish you all the best. So if you have any question regarding to my lectures, so all these contents are available with me. So inshallah, I will share with you people. Wish you thank you so much for watching my lecture. So after watching this lecture, so kindly subscribe this channel for my upcoming lectures.